They named it the One Big Beautiful Bill. That's actually what they called it. Beautiful. And while that name was being celebrated on Fox News and at White House signing ceremonies, the nonpartisan Congressional Budget Office, the people whose entire job is to count what laws actually cost and who they actually hurt, was releasing a different kind of number. 11.8 million. That's how many Americans will directly lose their Medicaid health insurance because of this bill. 11.8 million people. Gone from the rolls. No coverage. No backup plan. Nothing. That's not beautiful. That's a catastrophe. And you deserve to understand exactly what's happening, who it's happening to, and most importantly, why. Let's start with the basics, because the bill is deliberately complicated, and complicated is how they hide things they don't want you to notice. On July 4th, 2025, and yes, they signed it on the 4th of July, wrapping a healthcare gutting in patriotic packaging, President Trump signed the One Big Beautiful Bill Act into law. It cuts federal Medicaid funding by $1 trillion over 10 years. $1 trillion. That's a 15% reduction in federal support for a program that 80 million Americans depend on. 80 million people. That's roughly 1 in 4 Americans. And here's the thing they really don't want you to put together. Those cuts aren't going toward the deficit. They're not going toward roads or schools or the military. They're going toward tax cuts. Specifically, tax cuts that overwhelmingly benefit the wealthiest Americans and the largest corporations. The CBO again, nonpartisan, neither Democrat nor Republican, just accountants doing math confirmed it. The bill extends and expands the 2017 Trump tax cuts, which gave the largest benefits to people making over $1 million a year. And to pay for those tax cuts, they cut health care for people making near the poverty line. That is not a political spin. That is what the bill does. Rich people get a check. Poor people lose their doctor. Now let's talk about who's actually on Medicaid, because Republican messaging has spent decades trying to make you picture someone who doesn't deserve help. Here's the reality. Medicaid covers children. 40% of all American children are on Medicaid or CHIP. It covers pregnant women. It covers people with disabilities who need home care to function. It covers elderly people in nursing homes. About 2/3 of all nursing home residents in America are funded by Medicaid. It covers veterans who fall through the cracks of VA coverage. It covers working people who have jobs, sometimes 2 or 3 jobs, but whose employers don't offer health insurance and who don't make enough to buy it on their own. That's who this bill is cutting. Not some abstract category of undeserving moochers. Real people. Your neighbor who works at the grocery store. The home health aide who takes care of your grandmother. The kid in your child's class whose family can't afford private insurance. 11.8 million of them are losing their coverage. And that's just the direct Medicaid losses. Add in the 3.1 million who will lose coverage through marketplace plans, plus another 2 million who lose marketplace coverage when the expanded premium tax credits expire, and you're looking at potentially 19 million Americans losing health insurance because of this single law. 19 million people. The work requirements piece is where it gets particularly cruel, and I want you to really hear this. Starting January 2027, though some states can start earlier, adults aged 19 to 64 who are on Medicaid must prove they work, volunteer, or participate in job training for at least 80 hours every single month. 80 hours. That's essentially a part-time job on top of whatever you're already doing. And if you can't prove it, if you miss the paperwork deadline. If your employer doesn't respond to the verification request in time, if you're in between jobs for a single month, if you're caring for a sick family member and the hours don't add up, you lose your coverage. Not suspended. Gone. You have to reapply, which takes time, during which you have no insurance. Here's the thing that Harvard researchers specifically pointed out about this. Most people on Medicaid who are able to work already work. Studies consistently show that between 60 and 80% of working age, non-disabled Medicaid recipients are already employed or are caregivers or students. The work requirements don't get more people working. What they do is create enough paperwork and bureaucratic hoops that people who are already working lose their coverage because they couldn't navigate the system. That's not a bug in the design. That's the point. Make it hard enough that people fall off the rolls without anyone having to officially cut them. And then there's Dr. Oz. Let's talk about Dr. Oz, because it's important. Mehmet Oz, the TV doctor, the supplement salesman, the man who lost a Senate race in Pennsylvania by nearly 5 points, is now the head of the Centers for Medicare and Medicaid Services. He is literally running Medicaid right now. The American Medical Association has been sending him letters in September 2025, in December 2025, in March 2026, with recommendations about how to implement these new requirements in a way that doesn't devastate patients. The AMA joined with 90 other physician organizations to plead with Congress to at least extend the healthcare tax credits before they expired. On June 3rd of this year, less than 2 weeks ago, AH published new rules instructing all state Medicaid agencies to add community engagement requirements as a condition of eligibility by January 1st, 2027. That's the bureaucratic language for work requirements. The machinery is moving. The clock is ticking. Now, the rural hospital situation, this one doesn't get enough coverage, and it should make everyone furious, regardless of political affiliation. When Medicaid funding gets cut and coverage rolls shrink, rural hospitals lose patients. Rural hospitals already operate on razor-thin margins. They don't have the luxury of wealthy urban patient populations to cross-subsidize their losses. And when rural Medicaid patients lose coverage and can't pay their bills, rural hospitals close. Not theoretically. Actually, right now, rural hospitals across the country are warning that Medicaid cuts will force them to shut down emergency rooms, maternity wards, and in some cases the entire facility. And when a rural hospital closes when the nearest ER is now an hour away, instead of 10 minutes, people die from heart attacks, strokes, and car accidents that would have been survivable with nearby care. That's not drama. That's documented, studied, quantified medical reality. The Center for American Progress put it plainly. It is nearly impossible to carve out a specific population from these cuts: disabled people, elderly people, children, because cuts to Medicaid funding affect everyone through hospital closures and healthcare workforce layoffs. When the hospital closes, it closes for everybody. When nurses and doctors leave rural communities because the hospital can't pay them, they leave for everybody. Let's be absolutely clear about what this trade-off is. Congress looked at all of this, at 11.8 million people losing insurance, at rural hospitals closing, at work requirements that will knock working people off coverage through paperwork failures, and they said, worth it. Worth it to extend tax cuts that give the biggest benefits to people making over $1 million a year. Worth it so that the top 1% can keep a larger share of what they already have. That was the choice. That was the explicit, deliberate, calculated choice made by elected officials who then flew home to their districts and told their constituents they were fighting for them. They weren't fighting for you. They were fighting for the donor class that funds their campaigns. And they wrapped it in a name beautiful and signed it on the 4th of July, hoping the fireworks would drown out the sound of what they were actually doing. Here's what you need to do right now. Find out whether your state has already started implementing work requirements early. Some states can start before the January 2027 deadline. If you or someone you know is on Medicaid, check whether your coverage situation is changing. If you're in a rural area, pay attention to what's happening to your local hospital, because if Medicaid cuts hit your state hard, that hospital's future is not guaranteed. And if you have a congressional representative who voted for this bill, look up that vote. It's public record. It's on their website. It has their name on it. 11.8 million people. That's not a statistic. That's families. That's kids. That's people who wake up every morning and go to work and do everything right and still can't afford the healthcare the richest country in the history of the world absolutely has the money to provide, but has chosen not to. So that people who are already wealthy can be a little bit wealthier. Enough is enough. The bill may be signed. The cuts may be coming. But the people losing their healthcare still vote. And November is always coming. Share this if you think 11.8 million Americans deserve to know what's being done to them. Comment below, does your state have Medicaid work requirements starting early? Let's get this information out there, because the people in power are counting on confusion and silence. Don't give it to them.